All right, so thank you very much. We were bravely thinking about taking off our masks for this presentation. Are people comfortable? Yeah, okay. I was saying to Katie, I guilted all my students into wearing masks, so I've been teaching with a mask because I feel like it's only right. So this feels quite liberating. So we started this project, as Manuel said, about 2 years ago. Katie had just finished her master's thesis on a quite different topic, and I'd gotten some grant money from the COVID-19 fund at the university to sort of look at COVID-19 in historical perspective. And so she came into that project working on vaccinations, and then we applied for a grant from Associated Medical Services because this was before there was a vaccine for COVID-19, but we anticipated that should there be a vaccine, which of course we were very much hoping there would be, that vaccine resistance or vaccine hesitancy would be an issue. So we decided to start looking into the history of sort of modern anti-vaccination resistance. There's a huge history of vaccine resistance, especially to smallpox vaccination in the 19th century, which Katie will speak about briefly today. But our paper today will mostly focus on the uptick in vaccine hesitancy since about the 1980s. One thing I should say is that historians do things kind of strangely compared to scientists in that we tend to read our papers. We're going to try and avoid doing that today because it does not make for the most entertaining presentations, but because our evidence tends to be so textual in nature, rather than graphs and figures that are hard to display visually, we will be doing some reading. The other thing I should say is that collaborative work is actually very rare in history. So I'm very pleased to be doing this work with Katie. Okay, so when we talk about recent vaccine hesitancy, it's often positioned as an issue of misinformation. So most famously, there's the Wakefield scandal where he published this article in The Lancet that proved to be fraudulent, that posited a link between the MMR vaccine and autism. And it's often sort of said that, that a lot of the vaccine misinformation, or a lot of the opposition to vaccines comes from that mistaken belief that vaccines lead to autism. And certainly there is a lot of misinformation out there. We will talk about misinformation today. But we think actually a lot of the anti-vax information has far more sort of complicated origins than just the issue of misinformation. But it's an issue of misinformation that it most commonly gets pointed to. The other thing I was going to say with respect to the previous slide in the trucker convoy is that we'll be talking about the 1980s, the 1990s, and early 21st century, because I think vaccine hesitancy, vaccine resistance has taken on a different tenor in the COVID-19 age, and we'll talk about some reasons for that. It has sort of the roots in the movement that we're talking about today, but it's also gone in some new directions. So vaccine hesitancy is often portrayed as this issue of misinformation, but actually there's a lot more to it. We would argue that it's also rooted in alternative understandings of health and medicine. When we started looking for where we were going to find anti-vaccine rhetoric, we first went to women's health information, partly because there's a quite well-known book in the United States by a woman named Elena Canas who argues that the women's health movement has been very responsible for a lot of the anti-vaccine information, or that it's inspired by the women's health movement. And so Katie did a lot of that initial research, and actually we found very little in the Canadian context from the women's health movement that talked about anti-vaccines. I think you found like one article in all of the stuff you went through. So that in the Canadian context does not seem to be a big source of anti-vaccine information. Instead, where we found a ton of it was in health food magazines, and Katie will describe those in more detail. And part of what's happening in those health food magazines is they're expressing quite a different understanding of immunity and how it operates than is posited by the mainstream sort of health professions. And so, they really believe that, nature is best, and that we can best promote immunity through healthy eating and living. And so a lot of the anti-vaccine rhetoric comes out of that sense. Another thing that comes out very strongly is environmental concerns. So there's a sense in the health food literature that we're living in this increasingly toxic society. And of course, they're concerned about increased pesticide use, GMOs, residues, all these kinds of things. And they see vaccines as part of that, right? So we're injecting these toxic substances into our bodies, and so it's part of a larger kind of pollution problem. Another thing which we think really feeds into vaccine hesitancy in this time period, interestingly, is neoliberalism. So we often associate vaccine hesitancy with kind of like a sort of hippie mindset, which we often associate with the countercultural left. But actually, there's a pretty large historical literature that suggests that the countercultural left could very easily go right. And I think that's what we see in the anti-vaccination stuff, is that because they're promoting this sort of individualistic understanding of health, that you can do it yourself. There's a sort of health empowerment there. But it means that because you can do it yourself, you don't need to rely on the sort of expert advice of physicians. The other thing, of course, that's happening in the 1980s and 90s is that as budget deficits mount and governments are pulling away from healthcare spending or trying to spend healthcare dollars in more effective ways, one of the things they start to do is promote a lot of healthy living too. So it's coming out of two places. It's coming out of sort of alternative health movements, but it's also coming out of mainstream health, the Lalonde report and things like that, which is promoting that Canadians need to sort of exercise health vigilance themselves. Means that health again is in your own hands. You can take these other kinds of techniques to improve your health, such as improving your nutrition and exercising. The other sort of larger trend, which we think is responsible here, is growing maternalism and the sort of intensive parenting movement. So one of the things we see in the 1980s and 1990s is a new kind of motherhood being posited, where, it's sometimes positioned as parenthood, but really we would argue it's pretty much all about motherhood and how women should be raising children. And we see from Time survey data, right, that the amount of time that mothers are devoting to parenting beginning in the 1980s and 1990s continues to go up, despite the fact that more working women are working more hours outside the home. They're still spending more time with their children than they had in the 60s and 70s. And they're not only spending more time with their children, but they're seen, and this is partly the neoliberalism coming into play, they're seen as ever more responsible for the health of their children. And so, and often it's posed in almost these mystical ways, right? That a woman, if she's really parenting appropriately and she has that link with her child, she will know what her child most needs, right? She understands the child's particular unique vulnerabilities and can intervene appropriately. So, in one family, the sort of vulnerability that frightens parents might be autism or other things that are associated with vaccination. But it means that they sort of evaluate risks quite differently than how you or I might evaluate risks. So that's sort of some of the trends that we're talking about in this paper. And with that, I will turn it over to Katie.
All right, I'm going to discuss briefly the history of the anti-vaccination movement. Vaccine hesitancy or resistance has had a long history in Canada. As Michael Bliss has described in his book Plague, there were riots against vaccination and quarantine measures in Montreal during the smallpox epidemic of 1885. In English-speaking Canada, which was influenced by the larger British anti-vaccination movement of the same period, We see the first signs of resistance towards vaccination beginning with the 1887 Vaccination Act in Ontario and the implementation of one of its bylaws in 1894. The bylaw gave school boards the power to set requirements of proof of vaccination for enrollment. And when the Toronto School Board implemented this bylaw, this caused a huge outrage with parents and anti-vaccinators who quickly organized. And this would lead to the eventual formation of the Anti-Vaccination League of Canada in 1900. Despite this, for most of the 20th century, anti-vaccination sentiment was rare, and the Anti-Vaccination League itself had largely died out by the 1920s. In the first half of the 20th century, Canadian women were the focus of public health reforms, and as we've discussed, they are figures of the household who are responsible for their children's health, and this obviously has effects on vaccine intake. Women were targeted as future wives and mothers, as their knowledge of health, science, and childbearing were perceived as not only affecting their families, but the health of the nation. In the U.S. context, historian Jody Vanderburg Davies has argued that this form of scientific motherhood became the means by which moral motherhood met expert-driven science, medicine, rationalism, and heady notions of progress. Mothers were increasingly told to trust to medical science and to follow routine vaccine schedules. That being said, we do see a rise of vaccine apathy, a term proposed by Lawrence Monet and Heather McDougall in the latter part of the century. This vaccine apathy arose in part from poor training of healthcare providers who failed to emphasize enough the importance of vaccines. And we see this kind of attitude towards, for example, flu vaccines in popular magazines, where doctors are sort of dismissing flu vaccines for small children. They say it's only for people who are really chronically ill, don't bother, it's worse than getting the flu. And as well as a general issue of access. Important work done by Lawrence Monet suggests that the problem of under-vaccination, at least with the case of measles in Quebec, was less about resistance and more about institutional failures to ensure that people were fully vaccinated. And now I'll pass this back to Kathryn to discuss the period we're specifically looking at.
Okay. So, my slides don't want to switch. There we go. So sorry, this is it's very text heavy here. Really what I'm going to talk about is the reasons for the introduction of compulsory vaccination legislation in Ontario in 1982, which sets off the modern anti-vaccine movement in the Ontario context. So a vaccine against the measles was first introduced in Canada in 1964. And after that, you start to see rates of the disease fall quite substantially. But, you know, Canada's always competitive with the United States, and the United States was doing much better than Canada was in terms of cutting down the incidence of measles. And this was partly because the Kennedy Foundation, as part of its work against mental retardation, had really pushed states to pass laws mandating measles vaccination in order to attend school. And so by 1974, 40 states have adopted such laws in the United States. The Carter administration also had a childhood immunization program, which pushed the remaining states to take action. And by 1980, all U.S. states have legislation requiring children to be vaccinated in order to attend school. And so, Canadian governments, provincial governments are looking at this sort of relative success story in the United States and thinking, maybe we should be doing similar things in Canada. And so in the late 1970s, the Ontario government convened a compulsory immunization committee with representatives from the Ministry of Health and from the Ministry of Education to look into the possibility of putting in place a mandatory immunization program. Now, officials from the Ministry of Health thought it was a great idea that they could increase immunization rates. The Ministry of Education was concerned about how much work it was going to be to keep track of all the vaccinations. But they also worried that an autocratic approach to the issue of immunization could backfire. But by the early 1980s, rates of measles in Canada were 10 times higher than they were in the United States. Now, interestingly, the difference between the sort of mandatory situation is not actually the only reason why Canada was faring so badly in this struggle against the measles. We'd actually made much longer use of the killed virus vaccine, which isn't as effective than they had in the United States. So a lot of the people who were becoming infected with measles in Canada were actually people who'd been immunized against the measles, but they hadn't been fully immunized, or they had been immunized using the killed virus vaccine. At the same time, in the early 1980s, Ontario public health officials were also looking to Britain, where the growing reluctance of parents to use the DPT vaccine had resulted in a serious uptick in the number of whooping cough cases. And so, this all starts to push towards the mandatory vaccination. In 1982, 3 officials at the Department of National Health and Welfare in Ottawa published an article in the Canadian Medical Association Journal saying that the U.S. experience showed that more can and should be done to combat infectious disease. And they recommended that the provinces implement compulsory measles vaccination programs. In 1981, the Society of Medical Officers of Health in Ontario made a similar recommendation with exemptions for medical, religious, and philosophical reasons. You also saw school boards begin to promote compulsory vaccination. The school boards in Toronto, North York, and York Borough also asked the province to adopt this legislation. And so this legislation passes in 1982 with the support of all 3 parties in the legislature. And at this point, it only allows for exemptions for medical and religious reasons. And so, not surprisingly, the Committee Against Compulsory Vaccination is formed in the immediate aftermath of the passage of this legislation. And it's fighting for the addition of philosophical exemptions to the compulsory legislation. And it quickly gains a substantial membership. Approximately 400 people join within 14 months of the organization launching. They're also supporting court action. So in Algoma, the parents of 3 children took their case to the Health Protection Appeal Board. They wanted their children to remain unvaccinated, although I'll mention, this isn't actually in the paper, but I found it so intriguing when I was looking at the archives. One of their children, the oldest, attending school, actually went out and got himself vaccinated so that he could attend school. But the other 3 kids remained unvaccinated. And as this case sort of works its way through, the Attorney General is aware, of course, that the Charter of Rights and Freedoms is now on the books and is like, this is never going to hold up. And so we need to introduce the philosophical exemption as well. Bureaucrats were also concerned that, and I found this quite intriguing in the archives, that the vaccination legislation might be encouraging more parents to homeschool their children, and they really didn't want more homeschooling. And I think here we can see the links between the growth of this anti-vaccination movement and the growth of these kind of maternalist movements that are also promoting homeschooling at the same time. So in any case, the legislation is amended in 1984, with the amendments actually being introduced by the governing Conservative Party. And it expands the range of exemptions, also allows medical officers of health to fine parents $1,000 if they didn't have their children immunized. So this victory is achieved. The members of the Committee Against Compulsory Vaccination turn their attention to the issue of compensating children and their parents for vaccine-related injuries. So one of the couples involved in this movement was Colin and Donna Rothwell, whose son had lost his vision and most of his hearing, they thought, in response to receiving a vaccine. With the support of the Committee Against Compulsory Vaccination, the Rothwells sued Connaught Laboratory, which had produced the vaccine, his pediatrician, and the Crown. The case failed as it was unclear whether or not his disabilities were actually related to the vaccine or not. But the court did determine that the family had been inadequately warned about the possible dangers of the vaccine. And eventually Donna Rothwell becomes the president of the Association of Vaccine Damaged Children. And this organization grows substantially across the country in the late 1980s. Now, I should mention that the other provinces do not implement compulsory vaccination legislation, with the exception of New Brunswick. And then Manitoba had legislation around measles only for a period of time. So in getting compensation for vaccine-damaged children, this organization actually had some mainstream support. NACI also advocated that a fund be established to support families of children who had been harmed by vaccines. The Canadian Pediatric Association, the Ontario Medical Association also wanted to see a compensation program established. And of course, the US establishes the National Vaccine Injury Compensation Program in 1988, mostly because the vaccine manufacturers told them that they weren't going to produce vaccines anymore unless they were covered by such a program. So in 1987, Health Minister Jake Epp indicates that the government would introduce a program to compensate injured children and their families, but this ultimately never came to pass. Quebec does establish a program in 1986, but it's the only province to do so until Justin Trudeau announces a vaccine program, a vaccine injury program in 2020. So it takes a long time to get that in the Canadian context. So, as you can see, there's some real reasons for why this sort of movement ticks up in the 1980s. It changes its name a lot, which is why I've got so much text on this slide. So, 1982, you have the formation of the Committee Against Compulsory Vaccination. 85, the Association of Vaccine Damaged Children. The same people are pretty much involved throughout. 1992, it becomes the Vaccine Risk Information and Alternative Resources Group. And then it changes its name to the Vaccine Risk Awareness Network. 2014, VRAN becomes Vaccine Choice Canada, which has emerged as the leading anti-vaccination voice in Canada today. But many of the players from the 80s are still involved and active. The reason why we ended in 2007 is because, as I mentioned, the vaccine rhetoric becomes quite different over the past decade or 15 years or so. Partly that has to do with the explosion of social media and how people are accessing information. I also think that the publication of Jenny McCarthy's Louder Than Words, which really, brought forth this new kind of celebrity anti-vaccine activism, is important here. So we decided to sort of cut it off study off in 2007, just because it feels like the landscape gets even more complicated after 2007. So I'll turn it over to Katie to talk about some of the players that are involved in this movement.
All right. What we have noted from our survey of literature is the degree in which anti-vaccination sentiment was promoted by people who held maternalistic worldviews. As Kathryn has already pointed out, the anti-vaccination movement is often associated with well-educated middle-class mothers with a hippie bent. And this has also been argued by Thomas Frank, who has said that the counterculture could be individualistic and highly conservative. And this may be particularly true in the realm of healthcare and parenting. Healthcare magazines like Alive and Vitality, which were distributed for free and widely available at health food stores, were heavily influenced by the counterculture and often harbored skepticism about the role of pharmaceutical companies, were distrustful of the regulatory bodies of physicians, and urged Canadians to take health into their own hands by researching and subsequently buying natural products to boost immunity and improve their health. Some of the most influential anti-vaccinators in Canada wrote for these magazines, such as Etta West, Rhodey Lake, Helga Ferry, and Zoltan Rona. One of the earliest opponents to vaccination in Canada was the Finnish-born health food writer Paavo Airiola, who served as a health nutrition expert for Alive. Alive began publication in 1975, and by 1976 we are already seeing examples of anti-vaccination attitudes within it. For example, a parent writes in to Airiola and asks, "Should I get my kid vaccinated?" And he responds, "I am generally speaking very much against any kind of vaccination, especially for young babies. The dangers of possible complications and the harm of vaccination outweighs by far any real or imagined benefits. Areola directed readers towards his book, Every Woman's Book, Dr. Areola's Practical Guide to Holistic Health, which was published in 1979, and had a chapter dedicated to immunization. Every Woman's Book was largely conservative in its scope, denouncing things like the sexual revolution, the birth control pill, and even masturbation, which he considered a cause of zinc deficiency. Areola emphasized the role of motherhood in women's lives and suggested that it was the ultimate self-realization and the very reason why women were created. So we're seeing within this literature is this maternalistic view of womanhood. And this message of empowerment through motherhood can be seen with other anti-vaccine figures, such as Etta West. West was a key player in the committee against compulsory vaccines that was mentioned earlier. She self-described as a feminist in the 70s, and prior to involvement in the Canadian anti-vaccination movement, she was a co-founder of a business called Kid Power Unlimited, which manufactured baby carriers called Baby Matey and allowed mothers to carry the baby at their chest. West was quoted as saying she and her co-founder both have a very deep commitment to the revival of nurturing in our culture, and was described as being involved with various nurturing agencies such as groups dealing with postnatal counseling, breastfeeding, and the prevention of cruelty towards children, which is a familiar rhetoric of the 1980s when women were aligning maternalism and feminist ideologies and using it towards a reactionary means. In 1992, West would help form the aforementioned variants, later RAN, and then she also served as kind of the executive committee on the Vaccine Choice Canada. So it's important to note she had continuously had leadership roles throughout her time there. Rhodey Lake, who was the editor of Alive from 1991 to 2002, also contributed anti-vaccination sentiment in Canada. Lake had been a creative writing instructor and an art critic for Vancouver Sun prior to her role at Alive. She was passionate about her Christian beliefs, held strongly anti-choice views, and vocally opposed vaccination, which is why we're talking about her today. An example of the maternalistic beliefs that she held was that she was so pro-breastfeeding that she condemned the United Nations for suggesting that HIV-positive women bottle feed to prevent the spread of HIV. And her solution to the HIV crisis was dietary treatments, which she conspiratorially believed WHO was keeping secret because it was founded by transnational drug companies. Her editorials for Alive often denounced larger health networks and organizations. She complained that the United Nations vaccine efforts do not promote health. They spell compromised immune systems, illness, and eventual death. In the same editorial, she also criticized a Canadian vaccine campaign that featured the popular children's entertainers Sharon Lois and Bram, who urged the public to immunize your kids, boost their chances of health. In another editorial, she declared that child health is the responsibility of the parents and not the state. Parents should be left to look after their own children without state interferences. Under her editorialship, we noticed there was an increase of anti-vaccine articles in Alive. In another health magazine, Vitality, Helga Ferry published numerous anti-vaccination articles in the early part of the 21st century. Born in Germany, raised in India, educated in Switzerland, she eventually came to Canada with her Canadian-born husband and spent the 1970s passionately advocating for bringing Vietnamese orphans to Canada, going so far as to committing to a 3-day hunger strike to encourage the Ontario government to reduce the red tape associated with international adoptions. The couple established the Kuan Yin Foundation to bring orphan children to Canada. Ferry has been described by Tara Brookfield as a maverick mother who was willing to bend the rules to save children from life of foreign orphanages, somewhat to the dismay of provincial and federal authorities, who rightly feared that children might not actually be orphans, wanted to ensure that they were actually going to well-placed homes, and worried that Ferry's unorthodox behavior might endanger Canada's overseas reputations. Her interest in alternative health developed after she became ill with what she self-diagnosed as an autoimmune disorder. And again, this commonality of immunity pops up repeatedly in anti-vaccine literature. She believed her autoimmune disorder was caused by mercury fillings in her teeth, which again is another oft-repeated fear by anti-vaccinators who perceive the ingredients in vaccines as scary and unknown. One unusual anti-vaccination writer was Galen Langto, who was a conventionally trained physician. She was stripped of her medical license in Quebec after the publication of her 1995 book, The Medical Mafia: How to Get Out Alive and Take Back Our Health and Wealth. Langto was a mother of four, came to the anti-vaccination movement when she realized how many of us were mistreated by my profession where misogyny reigns. The medical mafia was directed at women who, as we've already mentioned earlier, were primarily responsible for the health of their families. She believed that health was a matter of individual control. As she put it, sickness is the malfunction of the soul, and that women needed to stop being submissive to others, especially doctors, which again echoes this ethos of the women's health movement of the 70s and 80s, but takes it to an extreme. She also bought into conspiracy thinking, complaining that medicine was controlled by world financiers and governments through Saint Who. She, like most anti-vaccinators, claimed that the vaccines were ineffective, that they contributed to many diseases such as AIDS and cancer, and that natural immunity was the best form of immunity. She paid particular attention to global vaccine campaigns and suggested that these campaigns were a form of population control in the global south. In Canada, she pointed to a recent hepatitis B campaign in Quebec, which she argued was only undertaken because Quebecers, like Indigenous people in Canada, were a bother who were sitting on a vast natural resources which multinational corporations wanted for themselves. These anti-vaccinators that we've been discussing hold maternalistic and, by extension, conservative views, aligning motherhood and individualism with their attitudes towards vaccine and wider public health debates. Some, like Ida West, also use the rhetoric of the women's movement to uphold their maternalistic views. Health food writer, frequent contributor to both Alive and Vitality, and anti-vaxxer Zoltan Rona also used the feminist health movement rhetoric in his 2000 book on menopause, which was published before the Women's Health Initiative study raised concerns about hormone replacement therapy. And he, in that book, condemns doctors for depending on HRT and their reluctance to embrace menopause as a natural occurrence, neglecting, of course, that with menopause there are often some very negative side effects that make your daily life hell. Rona, like Langto, is a conventionally trained physician, and his interest in nutritional therapies turned his attention to, later took his research towards alternative or complementary medicine, and it is this interest that he publishes from. His 1995 reference manual, Return to the Joy of Health, had a small anti-vaccine section, and his 1997 book, Childhood Illness and Allergy Connections, argue that vaccines are the only products sold in North America that carry the risk of injury or death, and which are legally required to be used by every healthy citizen. He tied vaccines to hyperactivity, autism, seizure disorders, chronic ear infections, hearing impairments, diabetes, allergies, asthma, mental retardation, and immune diseases. Basically a catch-all for any ailment of the 20th century. He argued that vaccines contained foreign proteins, aluminum, mercury derivatives, formaldehyde, unknown genetic material, which was often interpreted by anti-vaccinators, so really getting a lot of... That's all right. Which was interpreted by anti-vaccinators as material from aborted fetuses, and this ties into this larger conservative message and anti-choice view that we see with a lot of anti-vaxxers. Where are we? Okay. And other possible containments. His arguments were similar to those of other anti-vaccinators, that vaccines don't work, that infectious diseases were on the decline before vaccines were introduced, and he proposed alternatives to vaccines, which was similarly shared by other anti-vaccinators. He suggested that the idea of natural immunity was the best solution to vaccines, and he dedicated an entire chapter called Creating Childhood Superimmunity in his 1997 book, which argued that immunity could be boosted through the use of supplements. Supplements, of course, that could readily be found by readers at a local health food store. Complementary medicine, he argued, required greater commitment and sacrifice on our part, but that complementary practitioners, unlike mainstream doctors, would listen carefully and pay more attention to the needs of patients, who of course would be paying out of pocket to see them. This idea of individuals putting in and having the time and energy into finding alternative vaccines mirrors the demographics of anti-vaccine parents, who tend to be mostly white, middle class, and university educated. Rona's work also connected parents to anti-vaccination networks where they could find more literature and support, like his 1997 book, which directed parents to the Association of Vaccine-Damaged Children and Variants. Continuing this theme of superimmunity and supplements, Rona published Natural Alternatives to Vaccination in 2000, which combined accessible anti-vaccine arguments with immune-boosting recipes.
All right. So I'm going to talk now about some of the sort of main arguments that come up. And we've talked a little bit about these already, so I'll try and go through them pretty quickly. One of the things that I think is quite interesting about, this sort of experience of deciding whether or not you're going to vaccinate your child is you might get a slim pamphlet or something from your doctor, and especially in this era. But if you decide to go to the library and research it yourself, you've got these detailed tomes, right, which are describing why you should not vaccinate your child. Katie and I have sort of different experiences of reading these books. She remains, I think, more hardcore. I'm very pro-vaccination, but sometimes I read these and I'm like, oh my gosh, could this be true? It really is quite persuasive literature if you read it. She's more rational. But the arguments are detailed. They're backed with statistics and references, extensive references to scientific literature. Now, when you try and peel it apart, oftentimes it's not such accurate citation practices. So, for example, Zoltan Rona, who Katie talked about it, puts mortality from diphtheria was already reduced to 6 per 100,000 children in 1940 before the introduction of the vaccine. Mortality from measles was already less than 1 per 100,000 infected in 1955, 8 years before the vaccine was produced. But the diphtheria vaccine was actually produced in the 20s, not 1940s, so it's a problem there. And while it's true that mortality from measles seems to have declined long before the introduction of the vaccine, epidemiologists in Canada believe that it was almost impossible to actually estimate the case fatality rate because so many cases of the measles went unreported. But you see similar kinds of playing with statistics. So Catherine Diodati suggested that the Canadian and US governments manipulated statistics around polio, and she's got a very long argument around this, to create the impression that the disease had declined after the introduction of the vaccine, when in fact that wasn't the case. And of course, she totally ignored the fact that the number of cases of paralytic polio dropped precipitously after the Salk and Sabin vaccines were introduced. But they use these kinds of arguments to show that these kinds of infectious diseases that are supposedly protected against by vaccines really no longer pose a significant threat in developing countries. So you are quite safe to not vaccinate your child. Another argument that frequently was used in these texts is that vaccines are simply ineffective. This was used most frequently with regards to the measles vaccines. As I've talked about before, outbreaks of measles are not, uncommon in under-vaccinated populations. This is part of what we were seeing in Canada in the 1970s. But they would have statistics like the chances of, and according to the World Health Organization, the chances are about 15 times greater that the measles will be contacted by people who are vaccinated than by people who are not vaccinated, which is obviously ludicrous. But these statistics appear in other places as well. This sort of claim that the vaccines was ineffective were often accompanied by a long discussion of the risks of the vaccines, which included, in one author's view, encephalitis, subacute sclerosing panencephalitis, loss of muscle coordination, impaired speech function, personality changes, mental retardation, learning disability, hyperactivity, rage outbursts, aseptic meningitis, hemiparesis, and epileptic seizures that could lead to coma and death. So, obviously, if you're a parent making this decision, this is a pretty scary list of side effects that is being presented to you. Stephanie Cave's book, which seems to have been it's an American book, but seems to have been quite well read in the Canadian context. Always listed side effects in terms of mild, moderate, and severe. But often the severe ones were quite frightening. In addition, as Katie's already alluded to, in addition to the dangers of the active vaccine ingredients, nearly every anti-vaccine book included a very scary accounting of the list of ingredients in vaccines. So Stephanie Cave, for example, lists aluminum, ethyl glycol, formaldehyde, gelatin, glutamate, niacin, streptomycin, thimerosal, and it comes up at every single one. The most concern was around thimerosal, which is a preservative that contains mercury, and many anti-vaccination texts drew attention to the fact that, each individual vaccine contained only a small amount of mercury, children were now receiving so many vaccines that the dose of mercury could in fact be quite high. Thimerosal was no longer used in childhood vaccines in Canada. Diodati warned that aluminum salts could lead to neurological damage, and this was another claim that we saw over and over again in the literature. As Katie has mentioned, the anti-vaccine texts were deeply skeptical about the profit-making motivations of pharmaceutical companies. In a 1992 editorial in Alive, Rhodey Lake claimed, "It's not the physicians who are mostly concerned about so-called immunization. It's the manufacturers of the vaccines who are promoting this." There were a couple of studies done of anti-vaccine parents in the early aughts, both done by people who were doing their Masters of Science in nursing. So one which interviewed parents that had decided not to vaccinate their children on Vancouver Island concluded that parents expressed concern about the relationship between doctors and pharmaceutical companies, and the perception that that the relationship cast suspicion on physicians' motives in recommending certain vaccines. Another thesis, which covered southern Alberta, also found that this sort of skepticism of pharmaceutical companies come up over and over again. There's also, of course, this idea that natural immunity was much better and that this would be much more effective. Breastfeeding was continuously put forward as a way of better protecting your child from infectious disease than vaccination. There was also a strong belief in this anti-vax literature that in fact getting these childhood diseases was necessary. That it was basically build up your immune system, flex that immune muscle, and lead you better able to combat diseases as you got older. Anti-vaccine texts often reassured parents that childhood illnesses were incredibly unlikely to happen to their children, and if they did, they were unlikely to be severe. So they easily say, things like diphtheria are just really not a concern anymore, so you don't need to get your child vaccinated against it. And even going so far as to say that, basically well-nourished middle and upper class children do not get these diseases. So the class rhetoric is very clear here. And of course, one of the most commonly used arguments was these vaccines were simply not natural, and that we've learned through 50 years of degradation to the planet that we need to be more careful about the environment, and vaccines are part of this toxicity. So anti-vaccination writings and activism in Canada from the late 1970s to the early 2000s drew on widespread distrust of the so-called medical industry, especially pharmaceutical companies. They were also highly disdainful of arrogant physicians who they believed ignored women's health needs and their concerns for their children, and discounted women's knowledge about their own kids. Many of the people drawn to anti-vaccine activism had links to maternalist movements, as Katie has pointed out, and to the alternative health movement. While these movements are often associated with the countercultural left, in many respects they were deeply conservative. Jennifer Reich, who's a sociologist who's done extensive interviews with anti-vaccination parents in the US, argues that these parents are engaged in individualistic parenting, expanding immense time and energy strategizing as to how to keep their children healthy, while often ignoring the larger, harder to solve problems around them. They tend to focus on the subjects of their own expertise, which is their children. She rightly points out, and we would too, that this ignores the social inequalities that make some children more vulnerable to living in an unvaccinated or under-vaccinated world. The focus on the risks, the potential risks of vaccinations, combined with reassuring parents that their children were unlikely to be harmed by childhood diseases thanks to their superior immunity provided through breastfeeding and good nutrition, meant that parents, considering whether or not to vaccinate, were making the decision of whether or not to vaccinate for their own children rather than for society more broadly. And in this sense, I think the anti-vaccination movement is symptomatic of the growing atomization of our societies that we have seen since the 1980s. So that is it for the paper.